Hello, good afternoon. This is Dr. Sherif. I'm ENT surgeon. I am working in King's College Hospital in Abu Dhabi in Shining Tower. Hope you all happy new year and hope you all the best and to achieve all your goals. I would like you to subscribe to the channel and also share the channel to your friends and activate the notification button to receive all the new videos for my channel. Thank you in advance. Today I will talk about an important point. What are the most important 10 steps you can do to avoid the recurrent infection of your sinus, especially if you are allergic, if you are exposed to recurrent infections, or you have liability to get more infections in your sinuses. The first step we have to wash our hands very frequently, either by soap and running water or by alcohol. The second is to keep the nose moist. How to keep the nose moist? This is by using the nasal saline sprays. Nasal saline, which is formed of 0.9% of sodium chloride. This will help to improve the ventilation of your sinuses. It will also clean your sinuses from any discharge. That will help to avoid the infection. The third point, we have to keep the allergy well managed by using systemic antihistaminic tablets and the nasal sprays for allergy. The fourth point is avoiding exposure to irritants like fumes, gases, the smoke. The fifth point is the regular cleaning of the sinuses. As we said, using the saline nasal spray. We should make this use of saline sprays as a habit regularly every day or at least 3 times per week. It will also, as we said before, improve the sinus irrigation and condition. The next point is the use of the antibiotics. According to the guidelines, should be used for a specific time, and if the patient improved, no need to continue on the antibiotics for longer time. And also the use of the nasal steroid sprays should be used also in the same way for a specific time. Usually I recommend to give the steroid sprays for about 10 days to 15 days for any sinus infection. And after this, we can stop the treatment or we can follow with the physician. If there is still persistence of infection, the patient will continue the medication, otherwise he will stop the medicine. Some studies showed that the use of antibiotics and nasal steroid sprays for long duration, they will affect the health of the nasal mucosal cilia, which are responsible for the drainage of the sinuses. The use of the antibiotics and also the nasal steroid sprays may affect the normal flora of the mucosa of the sinuses if it's used for longer duration. The next point is the use of the probiotics. What are the probiotics? These are natural materials which are effective for improving the health of the mucosa all over the body, especially the GIT mucosa, and also it helps to improve the mucosa of the sinuses. It will help to improve the normal biomes or the normal bacterial flora, or which can improve the integrity of the mucosa. So if we use these probiotics, it will improve the integrity of the mucosa by proliferation of the normal beneficial bacteria for the mucosa. These probiotics are well known in the market now, and they are frequently used now to improve the health and the immunity and to decrease many kinds of infection, especially the gastrointestinal tract infection, and also can be used to improve the sinus infection, so improving the immunity and the allergy. It can be of great help now for many infections. The next step also we have to do, if the patient have bad septal problem, like bad deviation of the nasal septum or marked enlargement of the nasal turbinates, this will affect directly the ventilation and drainage of the sinuses. So these kind of patients should undergo surgical intervention of the nasal septum and also reduction of the size of the turbinates to improve the nasal airway and also to improve the ventilation of the sinuses. The next point, or the point number 9, If we are going to the swimming pool, we have to avoid the use of the swimming pools using the chlorinated water. We have to swim in the swimming pools containing salt water. This can be observed in the patients who have recurrent sinus infection or after needle surgery. When they go to swim in the beach, they find that the swimming in the seawater will help them to improve the breathing and also improve the sinus infection. The last step we have to do is improvement of the health and also changing the lifestyle. If the patient is smoking, he has to stop smoking. If the patient is not making any sports, he has to go to gym. If he has no enough time to go to gym, he has to make at least light sport, like walking for about 30 minutes per day, daily, or at least 3 times per week. Really, the change of lifestyle will help the patient to get better immunity, and this will affect his general health and also make him avoid any infections, especially the colds, the flu, and the upper respiratory tract infections. And this really will be reflected on the sinus health and the sinus infections. So these are all the points which will help us to avoid recurrence of sinus infection and also to avoid the worsening of any problems in our sinuses. This is my topic today, and hopefully you will find it valuable for you, and I wish you all the best and all the best health and to have a good time. And really I will appreciate if you will contact me by comments and ask me for any question. I will be happy to answer you, and for any topic you would like me to make a video for it, I will be happy to do it for you. And I hope you all the best, and see you again, and goodbye.